So hello and welcome to the UT Health San Antonio Community Support webinar. Today we are holding our live UT Health San Antonio Community Support Roundtable. My name is Michelle Mata and I will be your host for today's webinar. Today's webinar is being recorded and will be available later in the week. An announcement will be made on the COVID-19 website and via email, or you may subscribe to the HR at UT Health YouTube channel. During this webinar, we will have a number of guests joining us remotely. Please help me welcome them. We have Heather Kobbe, who is the Senior Director of Talent Management from the Office of Human Resources. We have Priya Nair Flores, who is the Organizational Development Consultant, also from the Office of Human Resources. We have Delphi Medina, who is the Senior EAP Account Representative for UT EAP at UT Health Houston. Dr. Mike Charlton, who is the Assistant Vice President for Risk Management and Safety in the Environmental Health and Safety Management Department. Lakeisha Johnson, who is the Director of Student Life. Ellyse Sanchez, who is the Senior Program Coordinator in Student Life. Dr. Liza Maldonado, who is the Behavioral Health Consultant for Graduate Medical Education. And Dr. Adriana Dyurich, who is the Academic Success Consultant for Graduate Medical Education. Thank you all for joining. At the end of this roundtable discussion, individuals will be able to develop a shared understanding of answers to questions related to COVID-19. And before we get started, we want to share some reminders to help you stay engaged in this webinar. For this webinar, we will be using the chat feature, and this can be found by hovering towards the top of your screen. And for this webinar, we will take questions during the webinar. When we do, please send your questions to the host, presenter, and panelists. This will assure that all of the panelists joining us remotely will be able to see the question displayed. And now, let's begin with our first question. Panelists, let me go ahead and display the question for you, and then I'll go ahead and say the question for everybody else. So the first question that came in was, what resources are available for the employee who is essential in the clinic, but now has children at home due to school closings? They do not have extra funds to pay for childcare, and they need to keep their employment, but now they're in a tough situation. Perhaps EAP or Human Resources can take that question?
Yeah, Michelle, this is Heather Kobbe. I can start with the response. First, just an acknowledgement that that is the exact situation that we're all trying to best help manage for. There's not any perfect answer for this because while we are working towards, and this week we will be launching a daycare matching site, which is essentially intended to provide those who need daycare services with those who might be able to provide daycare services. The arrangement will be one between the one in need and the provider to work through the logistics and the financial arrangements. But we hope that that resource, in addition to adding some external resources such as care.com and other resources we're looking into right now, will be more available to the workforce. And then in addition, the EAP is, I'll pass the baton over to them so they can respond on what kind of resources they have available.
Hi, this is Delphi Medina with UT EAP. Basically, if you are wanting help with childcare, you can call into our work-life benefits coordinator, and they can help research in your area for low-cost childcare. So you can call the 1-800 number, 346-3549. They will be able to do a search for you on who you can contact in the San Antonio or surrounding area for low-cost childcare.
Thank you, Heather and Delphi. Panelist question number 2, is it true that taking ibuprofen or Advil makes the virus worse and that only pain relievers to take symptomatic is Tylenol? Dr. Charlton, I think this might be a good question for you.
I'm going to have to refer them to their treating physician for that one.
Sounds good. So we'll be referring that. Actually, we also want to recommend that individuals probably call the wellness clinic if they've got specific questions regarding health. Dr. Bowling was not able to join us on this call, but we did want to point you to providers that will be able to assist you with specific medical questions. Let's take a look at the next question. So the next question is, how is UT Health addressing the PPE shortage? And for those not familiar with the term PPE, that's personal protection equipment.
This is Mike Charlton. That's an excellent question. That's one that I think most institutions like the health science area is facing. The strategy that we're employing, first and foremost, is the the Health Science Center really rallied with the local community and a lot of our community partners. We've had really just an overwhelming turnout of donations of protective equipment from San Antonio. A lot of our partner institutions, such as UTHSA, really rolled out the red carpet and have helped provide protective equipment to the Health Science Center and to our health community. So really kudos to all of them and to our community members for really stepping up for that. They've also worked with our research community here at the Health Science Center to kind of strategically tail in or rein in some of the research needs and really try to use any excess protective equipment that we might have had in a research laboratory and to try to divert that and use that for the coming patient care needs here at the Health Science Center. So I think those two things, probably first and foremost, were the things that we have been working on probably the past 2 weeks with I think a great deal of success. We have 2 dedicated buyers in our purchasing team that work tirelessly, really all hours of the day and night. They come potential sources of protective equipment to try to find new supply chain solutions to this particular issue. And so I think all of those things together really kind of work in concert to try to address the protective needs.
Thank you, Dr. Charlton. The next question, let me get and post this to individuals. I'm unclear if I fall into the vulnerable population category. How do I check?
I think this one's probably for me. This is Mike Charlton. Probably the best thing to do if you're unsure, I think it is best to have a conversation by calling the main COVID-19 helpline. The phone number for that is 210-450-8000. There are some trained healthcare professionals that staff that, definitely Monday through Friday. They also have some weekend hours to assist people recognize if they may fall into a more vulnerable situation, and they can walk you through that process.
Thank you, Dr. Charlton. Let me go and post the next question. The next question is for student life, and the question is, how is graduation going to be handled? How will diplomas be distributed?
This is Lakeisha Johnson from Student Life. So graduation has been, the in-person graduation ceremony has been canceled for May 2020. At this time, there is not an alternative plan to celebrate graduation. However, if individual schools or programs decide to conduct an alternative ceremony, those individual schools and program leadership would connect with those graduating cohorts to provide more information. Regarding degrees and how they will be distributed, the registrar's office is the office that normally handles or supports the distribution of the physical diplomas. And so if students have questions about that, I would recommend that they email the registrar's office, and their email address is simply registrars, registrars, @uthscsa.edu.
Thank you. Panelists, let me go and post the next question. The next question looks like it's addressed to either student life or environmental health and safety. I'd like to get together with other members of my class to study. If we stay 6 feet apart, can we still get together and study?
I think that may be a question, Ellyse Sanchez, student life, may be a question better for environmental health and safety.
Well, obviously, this is Mike Charlton. There is serious restrictions on assembly of people. So we do need to be extremely mindful of those assembly events. Really, any large kinds of gatherings are prohibited. Very moderate, maintaining the distancing that you indicated would be okay. Although I have to admit, I think you'd be better off doing it electronically or doing it through the computer or something like that. I really think this is the wrong time to get large numbers of people together just to study. I think you'd be much better off doing it on the computer or FaceTime or something like that. That was my suggestion for the time being.
Are you seeing other healthcare workers in the community experiencing burnout or stress?
and what are other communities doing to combat this?
I can take this question. This is Adriana Dyurich. We are seeing a lot of stress, anxiety, grief in the community, and definitely among other healthcare workers. This is not an experience that is unique to us. This is a shared experience, which in one way makes it, I don't want to just say normal, but it's true. Anxiety is it's an adaptive response to fear, to a situation that is dangerous, and we are living those times. Now, that doesn't mean that we have to act out on that anxiety and fear. It's important to recognize it. So part of the video that we had posted before is talking about strategies and coping mechanisms for anxiety and stress and burnout. And what I see other communities doing, I'm sure you're aware now that New York, for example, has more than 6,000 mental health workers volunteering in a hotline. We are thankfully not even close to the situation in New York, but we have EIP that has mental health professionals available to some of our staff, and we have the GME office with mental health professionals available to our residents and fellows. And there are other resources that we can list and that they're listed in the video presentation that we posted before about burnout and stress. I would also highly recommend that we stay connected to our teams in different ways. We can get creative about this. We can be connected through the internet, just, texting our friends and our coworkers, how are you doing today? If you are still going to the hospital or to work, I would say a smile, just a check-in, and we can survive this as a community much better and stronger than if we do it by ourselves.
Hi, this is Delphi Medina with the Employee Assistance Program. First, I want to say to anybody who's working the front lines and the first responders in the hospital clinic setting, thank you for all that you do. Also for the people who are working remote to support you, such as us today and giving this webinar. Everyone's working. Unfortunately, we don't have any immediate answers because everything is fluid. We're getting new information from the federal to the state to the city on new laws and being able to deal with COVID-19. But I want to piggyback off of what Dr. Maldonado said. It's the three things is social support, being able to reach out to one another, not only if you're in the work setting, but also outside the work setting, having huddle-up meetings, being able to talk about what your day is and what that's looking like, reaching out via text, via email, remembering why you're doing what you're doing, remembering the passion of why you got into the healthcare industry or the social work industry or LPC, LMFT, nursing, any type of area related to healthcare, remembering that. Also, being able to take a time out, taking a breath. On the UTEAP website, which I know I sent to HR, where you can find mindfulness tools to be able to take that 5 minutes to take a break. Remembering if you are working in the hospital setting, to go and take a walk outside and come back in, walk down the hall, check on one another. So I know this is a whole new world. Always remember you can reach out to EAP, the 1-800 number, and ask if you need to vent. Everyone needs to be acknowledged and validated during this time. All feelings are valid. It's a scary time. It's a challenging time, but we are here to help you. Thank you.
Thank you, Dr. Dyurich, and thank you, Delphi. The next question, let me post this to the panelists. What are some ways my virtual team can stay connected? And it looks like this was addressed to Human Resources.
Thank you, Michelle. This is Heather. There are several creative ways that people can stay connected. It can be through different rituals, if just even a regular meeting with coffee, tea, or checking base in the morning. It's good for our managers to check in with their team just to see how they're doing. This is an extremely difficult time for so many people, and Sometimes people feel more disconnected when they work virtually, but the more over communication right now is better than little communication. So I would just say, especially because you're able to be virtual, if you can look at each other on the web or hear each other's voices, that will help people feel more connected.
Thank you, Heather. See, the next question says, I don't know how to use Teams. Is there any education or support for this software?
This is Heather again. Our IMS organization has done a commendable job putting a lot of resources out on the internet. I believe, don't quote me on this, but I believe it's actually out on the COVID-19 site or close to, or perhaps the homepage. But we can absolutely provide a link to where the resources are to help folks use Teams more efficiently.
Absolutely, and additionally, this is Michelle, there are also tutorials that can be found on Skillport as well, and you can also go to, I believe it's the Telecommuting 101 website under IMS, and they have resources for learning Teams as well. Panelists, let me post the next question. Thank you, Delphi, for sharing those websites resources on chat. The next question is, with all the uncertainty and stress, how do I stay emotionally connected to my work during this time if I'm not a clinical care provider?
I can take this one. This is Dr. Maldonado with GME Wellness. It's very hard, I think, to stay emotionally connected when we are feeling so much stress, but it is not impossible. I always like to emphasize the importance of sticking to a routine, because it can be very easy to be thrown off whenever we're working remotely. Because I've had to, I have two young daughters who are home with me and my husband who both work full time. And so I've had to do this in my own home, but it can help to reduce stress to wake up at the same time that you normally would if you were driving into the office. Have breakfast at the same time, go on a walk if you usually do that with your pet or with your loved ones. Start working at the same time, and if you find it helpful, and this goes along with staying connected with your team, set up a regular Zoom meeting. I can't say enough great things about Zoom. Zoom is a very easy platform that is free to use. I believe that the free version limits the time of a meeting to 30 minutes if it's up to 3 or less than 3 participants. But 30 minutes is plenty of time to kind of check in with each other at the beginning of each day and say, okay, this is what I'm going to work on today. What are you going to be doing? What are some hiccups that you have found? So really simple, check in with your team at the beginning of the day. And also, have lunch at the same time each day. And most importantly, be done at the same time each day. This is something that I learned from my husband, who's been working from home for IBM for about 12 years now. He said, you need to compartmentalize the work, because when we're working remotely, it can be very easy for our work to spill into our personal life. And just because we are in the middle of a pandemic does not mean that we need to be on all of the time. We need to set that deadline at the end of each workday. This is when I'm going to be done, and this is when I'm going to move on with the rest of my day. I also want to emphasize, like I believe Delphi did a moment ago, the importance of adding a relaxation or a mindfulness exercise into your day. This is going to help reset you and maybe also help you stay more connected, not just to your work, but to your children, to your spouse, to your loved ones. Adding some time for self-care. And I love the resource that EAP provided a moment ago. We also have many resources that we added in our webinar. Dr. Dyurich and I added in the webinar that was put out last week. So, you can even do the exercises with your team if you set up Zoom and you screen share. This is something that my daughters have been doing. One of them is in pre-K, and she's been doing story time with her class through Zoom 3 times a week. The other one is a 4th grader. She's been doing yoga with her classmates almost every day through Zoom. So add some of that at the end of the day, because reducing your stress to a semi-normal range is going to help you stay more emotionally connected, not just to your work, but also to everything else that you want to be doing right now in your life.
Dr. Maldonado, this is Priya. I just wanted to throw in a resource out there that we have on the COVID-19 website. We have general COVID resources, but we also have some other resources we've compiled that have these free mindfulness apps and exercise apps, resources for individuals and families. You can find it by going to the COVID-19 website and looking under Human Resources, Continuity, and on the sidebar on the right, you'll see COVID-19 resources. It's a great guide with a lot of these compiled resources that are available.
This is Dr. Dyurich again. Thank you so much, Priya, for that information, and thank you so much, Dr. Maldonado, for such wise words. I am definitely trying to follow your advice. I just want to throw out there one more thing. Even those that are not engaged in direct clinical care, I want you to connect with how important your work is for all the rest of the team. We know that we need all of you to maintain a sense of normalcy, to know that when our direct clinical workers need support, you are there for them, and we need to continue to, keep the institution moving, our students graduating, our patients being taken care of. So although you might not have a direct clinical care position, you are very important to the team. And I think it's important to keep that in mind, to be able to connect emotionally with what you're doing.
Hi, this is Delphi Medina again with UTEAP. I just put on the chat the website for mylifevalues.com and also the username and password that the UTHSA employee population can use to get into that site. There's a wealth of information for you to ground yourself, mindfulness tools. We have Mind Check on that website that is able to be a good monitor for taking your stress levels every day. There's tons of webinars on every category that you can imagine, especially during this time on stress and anxiety. That's all free to you, and also wanted to remind you to send this information to your family members, because EAP does cover your spouses, your children that are in the household, that they have access to these resources that they can find 24/7, especially if you're working and listening, if you're in the hospital or clinic settings and you have some downtime. Go to this website and be able to find a wealth of resources. I know that HR has placed some of the links that we sent them last week that's on the resource page that Priya was talking about. But I wanted everybody to know there's a wealth of information. If you need any help navigating that, please feel free to contact me at delphi.a.medina@uth.tmc.edu, and I can help navigate that with you via email or a personal phone call. So I just wanted to let everybody know you have those resources as well, outside of just calling the 1-800 number and having in-the-moment support or finding a counselor via telehealth. The other thing, for those of y'all who have been watching television, Brene Brown was on 60 Minutes. She was on a lot of the morning shows this morning. Her podcast is #1 on Apple, so I highly recommend for you to listen to her or go to her website. She has a wealth of tips right now concerning COVID. Thank you.
Thank you, everybody. Let's go ahead and post the next question, which is actually related to the last question we just asked. And this question is, I'm finding it hard to find moments of self-care. What advice do you have for that?
I'll start on that. It's very important right now, as stated just a moment ago, about getting a routine into self-care. So for those of y'all who are working remote and able to take a break and go outside and walk down the street or do the flight of stairs if you're in an apartment. That's encouraged. I know I've heard a lot of feedback recently about, man, I'm working from home, but I've got to get somewhere so the kids, so I can have my own space because I'm not in my office where I'm working away from home and you've got everything coming at you at once, whereas if you're in the work setting, you're able to just focus on work. So being able to work, if you have your spouse and y'all are working together, to trade off and being able to take some time to yourself. I know the kids are used to having their routine, trying to keep them onto routine as much as possible, allowing a certain amount of time for electronic devices, and also if having a backyard or having access to be outside to give them that fresh air. Working to give yourself some downtime either in the morning or in the afternoon or evening, just taking some time to yourself. So again, why I put the My Life values, so you can have those meditation, mindfulness exercises to take a moment and take a breath. Reaching out, whether that's via Zoom, whether that's WebEx, on your phone, via FaceTime if you have an Apple phone, or Duo if you have a Droid phone, and being able to connect with someone, and whether that's friends, whether that's coworkers, and taking the time to connect and not isolate.
Thank you so much, Delphi. I just want to add, because that's all beautiful and important information. This is Adriana Dyurich again. I just want to add, this is a moment to take care of yourself with self-compassion, a lot of self-compassion. And I'm going to post a link to Dr. Nair's self-compassion organization. She's a professor at UT Austin. It's hard, it's impossible to be perfect, but it's especially hard to be perfect in times like this, when we are also experiencing anxiety, fear, and uncertainty, a lot of uncertainty. So to practice a little bit of self-compassion and grace, I know that things might not look exactly the way we want them to look, but we still accept and love ourselves and the people around us, and that we will together get through this is very important. So I want to just add that to your wonderful comments.
Dr. Dyurich, I want to piggyback off you, because I know Dr. Neff very well. She works in collaboration with Dr. Brene Brown, and she has excellent meditations on there that are for free, especially a 5-minute one called the Self-Compassion Mini Break. So I highly recommend that website. Thank you so much for mentioning that. Thank you.
Of course.
All right, panelists, let me post the next question. The next question looks like it may be for HR. The videos mention a resource guide. Where can I locate this?
Hi, this is Priya. I had mentioned it before, so I thought I'd jump in here. Off of the COVID-19 website, which you can get right off of the main page of UT Health, once you click on that, there will be a set of a ribbon right underneath there that you can click on HR continuity. If you click there and you look on the right side, you will see COVID-19 resource guide. And as I mentioned before, there's a lot of good resources there. And we will probably be updating it with some of the resources from this call as well, including the selfcompassion.org, and as we have more information about childcare, etc. So it should be pretty straightforward. One other thing is we are going to be sending it out as one of the resources today after the call, just to remind people of where to find the video webinars that were done previously, and the resource guide should be included in there as well.
And in addition to the videos, if you viewed them and look in the description, we've included each of the links within the description on YouTube. So if you are trying to figure out if the link's going to a certain spot, that's another resource that you can use if you happen to be away from a computer and you've got your mobile device available to you. The next question looks like it's for HR. Let me go and post it. The question is, how will payroll be handled? For those who have direct deposit, when will they see it in their accounts? And for those who utilize paper checks, can they still pick up their checks over at the bursar's office? And how would they request it if they want their checks mailed?
Okay, this is Heather. I'm going to try to answer this. I do know, so direct deposit is handled the same way it's always been. And for those who are not on direct deposit, this is the perfect time to get on direct deposit. I will have to get back on what the hours are of the bursar's office, because I do know that they did change their hours, and I'm unfortunately not recalling when those hours are. So let's capture this question so that we can respond.
And one other addition, Heather, because I had a chance to talk with compensation about this, that as you mentioned, yes, director's deposit will continue as is. For paper checks, the bursar's office is the right place with the UT Health ID. I also don't know the hours, but we'll definitely get that included in some FAQs. And then for those who want their checks mailed, they will need to request it by email, and we'll post the address they need to send that to. It's pay-admin@uthsca.edu. So I will post that now in just a sec.
Thank you. See, the next question is coming up. Looks like it's also for HR. And the next question is, what if I can't work from home or I don't have enough work that I can accomplish at home?
So it's a great question. So it really breaks down to why someone is not able to work from home. There could be technology barriers. There could be internet barriers. There could be phone barriers as well. And so we are going to be deploying a survey that will get to a lot of what barriers people are really experiencing, so that we and the IMS organization, in concert with the individual's leader, can try to help facilitate ways that work can be done remotely that maybe they haven't quite thought about yet. So because we don't know how long COVID is going to last, a lot of this is still really ambiguous, and so we do want to be prepared in case we're remote longer than any of us would like. So at this point, I suggest if there's specific questions, they work directly with their leadership, and they're also more than welcome to call HR, or email, I should say, hrpartners@uthsca.edu, and we will talk to them about their own specific situation.
Thank you. Let me post the next question. And the question is, looks like it's directed towards HR. What happens if I exhaust my paid time off and sick leave, but I still have to be at home due to illness or dependent care?
So we, HR, in concert with many institutional offices, have been working really diligently to respond to legislation that was passed and is going to be effective April 1st, and it's called the Family First Coronavirus Response Act. Over the weekend, even as recent as Saturday, the regulations were even changed again. So at this exact moment, we don't have an answer for this. We are continuing to try to drive people to be as creative as they can to work from home, but we realize that not all jobs and all people are able to do that. So we anticipate to have more clear guidance on this in the near future, but as of today, I don't have a clear response.
Okay, the next question is, should we be sterilizing containers of food or any other containers before we bring them into the house? It looks like this one might be for environmental health and safety.
So the question pertains more to bringing packaging into your residence. So the particular virus that we're talking about, that Heather was mentioning, it's a respiratory virus, it's an airborne hazard. So it's normally spread through respiratory droplets. So it's spread mostly by a mechanical action of people coughing and aerosolizing it, and then a person inhaling or getting perhaps those respiratory droplets in their eyes or in their nose. There is a potential, although it seems to be quite a bit less, mechanism where it could be on a surface where you touch a contaminated surface and then touch your nose or your eyes. So there is a potential pathway there. It's a little less common and not particularly well studied, but just generally sterilizing large packages that have no known exposure route or known pathway. That would be a very, very unusual circumstance. I'm not sure what that would be a very low risk scenario. We're much better off practicing the primary things with the social distancing that you probably have seen, just going to H-E-B and the limits on the number of contacts that you have, gathering, and then really the heightened awareness on good hand hygiene and practicing this good hand washing technique that we've talked about during the podcast. So I think if we did those three things together, that's probably far more impactful than like a package that perhaps you may have ordered from someone.
Thank you. Let me go and pose the next question, and it is a related question. The question is, how can I stay safe while grocery shopping?
That's a good question. That's a really current question, one that I think probably everybody who's participating in your course is probably asking themselves. I think to H-E-B or perhaps Walmart's credit, they really have done a great job of controlling the access to their facilities. When you go there, they have these little spacers on the ground to help remind you and others about limiting that distance, that 2-meter distance between you and the person in front of you. And they really have made it extremely orderly and make it pretty easy to comply with those things. So kind of hats off to them for really helping everybody. Those are the primary things that you try to do, is to maintain that distance. I think most people are pretty mindful about washing their hands, before and after they're touching common objects, such as a shopping cart and that sort of thing. Try your best not touch your nose, your eyes, if at all possible. It's really hard for people to do that, but try to be very mindful of that while you're in those kinds of public settings. Those are probably the best things that we can do.
We have a few questions, or at least one question that's coming in directly to the host. If our participants can remember to send their questions to host, presenter, and panelist all at the same time, this will assure that everybody on the call that's serving as a panelist will be able to see that question. The next question, we post that question. How can we move from clinical care situations into our home situations safely? What recommendations do you have to maintain safety?
This is Mike Charlton. I'm not sure I entirely understand the question. If the question is what sorts of things can you do maybe after you finish your shift, far and away the best thing that we can do is make sure that we wash our hands. Obviously, when we're at work, we're wearing the appropriate protective equipment whenever we're in the healthcare setting. The second kind of part to that is just really meticulous and diligent symptom monitoring. And really those things kind of together really are our best bet. You'll find that most of our clinical facilities now have a couple of things. They have screening questions for patients to ask if they have any respiratory symptoms. And I think you'll also find that most of our clinical settings have a screening process, really even to just get into the facility. They do a very brief screen for symptoms. So really all those things together are what would protect us in this situation.
Thank you. Let me post the next question. And the next question is, do we know yet if we've had the virus, can we get it again, or can somebody get it again?
That is a good question. To be honest, I'm not sure there's a lot of data to that, although I can say that there have been people, at least news stories, where people have had the virus and are now back to work. And I just read an article today about somebody who was ill in New York City a number of weeks ago and is now released from the hospital and essentially back to work. I don't know about if there's a potential to get sick again, presumably your body will build up the antibodies to the virus. So I would think that would be a very unlikely scenario, although there's not a lot of data to really support that one right now.
Thank you. The next question we have is possibly for HR. Regarding the work from home survey, when can they expect that?
I wish I had an exact date. Definitely by next week. Our goal is to deploy that this week.
And the last question I have for this moment, let me post that. Who do I go to for more questions, or where do I go for more information?
This is Heather. I can respond. I think the best place to go is on the COVID-19 site. That is where most up-to-date current information is going as soon as it becomes real-time. So I would definitely start there as the source of truth. And if information isn't there directly, it's generally linked there.
This is Mike Charlton. I would echo Heather's comment on that. For something else that maybe perhaps is a bit more health-related, I guess I would also encourage them to call the 210-450-8000 hotline if somebody needed kind of more of a health-related question. But those are probably the two primary resources available to the UT Health community right now.
And this is Lakeisha Johnson. I would say for students, I would also echo that the COVID-19 site is just a great site for all resources, and also let students see from an institutional standpoint how we're responding to the COVID-19 concerns. I also would recommend that students stay connected to their schools and to their program leadership, because they will be sending out information that's more program and school specific. And then last but not least, if students want to know about and connect to campus-wide student services offices like ours, like Student Life, registrars, library, etc., then the students.uthsa.edu site has links to all the campus-wide student services departments.
Thank you. Those are all the questions that have come in at the moment. I also want to give our panelists a chance to share any additional information that they would like to provide now that we've kind of have an open forum and we've addressed all the questions that have come in at the moment. We'll start with Heather. Is there any other additional information you'd like to add?
I don't think so. I just want to thank all the panelists and also everyone who got on the call today. We appreciate the time and energy you're spending getting connected to understand the information that's out there, and appreciate the patience of folks and the compassion that we are seeing, because there's in times of anxiety, people want answers, and sometimes we don't have the answers as quick as people would like. So I do appreciate everyone's time, and thank you very much.
Priya, is there anything you'd like to share?
No, I echo Heather's statement. Thank you.
Thank you. Delphi, how about yourself?
Yes. Again, I just want to say thanks to everyone who is working front lines and also who are working remote in order to support everyone. It's all a team. It's all a village. So everyone is doing their part. If you need EAP services and need counseling consistently during this time, we are available telephonic. We do have external provider network who can provide telephonic and or telehealth via, Skype Business, via WebEx, via Zoom, via Doxy, and plus the governor has released that private practitioners can also use FaceTime and Facebook and Instant Messenger during this time, so everyone has access to counseling. So just wanted to let everyone know, as a UTHSA employee, you and your family members have 5 sessions available to you, and that is free. It's extra benefit that UT Health San Antonio provides for y'all to have. So just wanted to remind everyone, we do have a crisis call counselor, which I will be that starting April 1st. So if you need in-the-moment support 24/7, then you can call the main number, which is 1-800-346-3549, or our local number, which is 713-500-3327. And to remember to go to our website at uteap.org. We do have a COVID-19 page, and also to my life values that I put on the chat for a wealth of information for mindfulness and webinar topics that are free to you on various categories. So thank you.
Thank you, Delphi. Dr. Charlton, would you like to add?
Well, I would say I would appreciate all the really interesting and good questions that we received today. And I would say to really everybody listening, the worst question in the world is one that never gets asked. So if you're at home and you have a question or if you need a resource, you could go through some of those resources that we already mentioned previously, and there are a great wealth of information. There's a tremendous amount of resources there. There is a very talented team here, mostly from our nursing school, that is here to help you if you had any health questions. Or you can always call Environmental Health and Safety. We're here. We're happy to follow up. We really are working very hard to try to answer all those questions as best as we possibly can. So this doesn't have to be the end of the conversation. This can actually be the beginning of the conversation. So please do let us know if you run into any additional difficulties. We're happy to help.
Thank you, Dr. Charlton. Dr. Dyurich and Dr. Maldonado, would you like to add some words?
Sure.
Oh, go ahead, Adriana.
Go ahead, Liza, please. I know you're going to say beautiful things.
Thank you. Well, I was just going to echo what you had mentioned, Adriana and Delphi had mentioned about the importance of self-compassion. If you find yourself asking, why is this so hard? Why am I so stressed right now? Please remember, it is because these are unprecedented times. Never before in my lifetime have I been through this level of global pandemic. I don't know about you all, I'm guessing it's the same. So when you are either at home, working from home, trying to figure out, how can I be productive, or whether you're in the hospital trying to figure out how can I see, more patients, how can I do more clinically, you have to remember you can only do so much. These are unprecedented times, and we are only human. If you're worried about your children at home getting behind on their schoolwork, it will be okay. I promise your kids are going to be fine. They're going to catch up at some point, okay? This is something that my husband and I were kind of meditating on a moment ago. So remember, we're only human. We have to stop beating each other up, beating ourselves up for the way that we're coping. The importance is to take care of yourself so that you can continue being a part of this amazing, beautiful healthcare community.
Thank you, Dr. Maldonado. When you say we're only human, you make me reconnect. I've been finding myself intentionally connecting to that awareness of how we really are all one and how we are so closely connected to each other, and that big truth that we need to take care of ourselves so we can then take care of others. I've been feeling extremely proud and grateful for all of our UT and UTHSA community, and I thank all of you, the participants, the panelists, the organizers, the hosts, everybody for doing this. It's helpful to me as well, and I hope it's helpful to all of you to be able to have these conversations.
Thank you. And finally, Lakeisha and Ellyse, would there be anything that you'd like to share regarding student life?
Sure. I would just like to say to the students that are participating that we just really appreciate your flexibility. We know that there's been a little bit of disruption moving everything online, but we see that you all are doing a great job transitioning, and that all the services and the support that you had within your schools and even throughout the campus, campus-wide student services offices like Student Life and our colleagues, that we're still here and we're still available, so feel free to reach out anytime you need us.
Thank you. And we are getting close to our time, so I want to thank each of our panelists who joined us today, and I want to thank each of our participants who joined us live, and to those who will be joining us later on when they watch this recording on YouTube. And we hope you found this information helpful. This concludes today's webinar. Thank you, and stay safe.